Hi everybody, it's Dr. Linda of the Vascular Birthmarks Foundation, welcoming you to the first of 2024 VBF Facebook Live, there we are, with our very own Dr. Stuart Nelson, Medical Director of the Beckman Laser Institute, VBF West Coast Medical Director, and all around one of what we call the VBF Laser Kings. So welcome to VBF. Dr. Nelson, thank you for being here with all of us.
It's an honor and privilege, again.
And I'm waiting to see it on here so I can get the questions. We will be taking your questions live. Oh, here we are. Good. I see it. All righty. So, even though it's 1 minute before, let us all know that you can see us. Send us the thumbs ups and send us the bubbles that you see us all. Say hello and where you are from. It's been a while since Dr. Nelson and I have done Facebook Live. I think it was last year, 23, yeah, was the last time, so once a year.
I think it was in September.
September, okay. So anyways, I am out here in sunny Southern California, getting ready to go home into some of the bad weather, which you were telling me about today.
Good luck with that.
1,000 flights were canceled or something.
10,000 flights
10,000 flights canceled. So anyways, there's going to be, as people are starting to come on, one of the new features we have, by the way, just so you know, is for visual impairment and accommodations. We are now doing what we say is coming up in words so people can actually read it.
Okay.
So now
It's being transcribed then.
Yeah, it's being transcribed. So then people can always go back. We have the ones that you and I did from back in 2017. Hi Ava, hi Samantha. Hello everybody. Let us know where you are from. We are taking questions tonight on, still have my long COVID cough from November 25th. We're taking questions on all things laser and other general questions that Dr. Nelson can answer, but mostly all things laser. Hi Ava. Ava says hi Dr. Nelson and hi Dr. Linda. She just had a treatment with Dr. 𝗗𝗁. He went pretty deep on this treatment, trying to clean up that last bit of face syndrome, hemangioma, which, by the way, I really think it's a different type of hemangioma. It doesn't seem to respond as well, the face syndrome cases with laser. I don't know how many
Actually, for some reason, the 𝗧𝗶𝗺𝗃 syndrome cases seem to come in spurts. I won't see one for like 6 months, and then all of a sudden I'll see 3 in a month. And in my experience, you have to do the workup and you have to get them on the oral propranolol, but in my experience, they respond very, very well.
To laser?
Yes, very, very well. And they clear very, very well. All the ones that I have personally done have all gotten 100% clearance. Now, that took, 5 to 10 laser treatments to do that, but they generally respond very well. I mean, the propranolol is good for the deeper component, and the laser will solve the cutaneous component problem.
But what about some of the concerns that segmental hemangioma shouldn't be lasered because they can ulcerate?
Well, this question comes up all the time, and I've been doing this since 1988, so 35 years, and in my personal experience, I have never seen a hemangioma ulcerate after a laser treatment.
Okay.
Now, maybe that's just... I've been very fortunate. I've been very careful with these cases. I mean, your goal when you're treating hemangioma is you want to induce endothelial cell apoptosis. So what that means is you want to stop those cells lining the blood vessels in the hemangioma from proliferating. You want to kill those. Stop the cells. You're not trying to coagulate the blood vessel. You're trying to induce endothelial cell apoptosis. And to do that, in my experience, you can use very, very low light doses of the laser to achieve that.
Oh, so this is cool. Robin Duarte. Hi, Dr. Linda and Dr. Nelson from
San
Diego.
Tomorrow.
I look forward to seeing you tomorrow. I'm here.
Yeah.
I'm here in Orange County. So, hi, Robin. Good to see you. You've been treating Robin, right, for a while now. I know.
She has 𝗧𝗶𝗺𝗃 syndrome, and maybe I'm going to ask her tomorrow if she ever got that. I'm also suspicious of one of her arms is very enlarged. So I was trying to get her primary care physician to order an MRI, MRA of her entire right upper extremity, if I remember right. So I'll be looking forward to talking to her about that, whether or not that got done.
We might want to do some gene testing too, because this is being very definitive when there is an extremity also involved. You want to look and see, does it have the PIK3 mutation? So,
but that PIK3 mutation is very difficult to prove. You know, we have seen some patients with overgrowth syndrome that we've tried to get started on the 𝗧𝗃𝗃, and the problem has been that some institutions will require that you have a definitive biopsy. And I was at a meeting a couple of months ago where one of the pediatric dermatologists told me he had to biopsy a patient 3 times before he got a positive result with that test. I mean, there's only one place in the United States that does it, WashU in St. Louis.
I know
it's
that.
a very tricky test. And in fact, I'm arguing with some of my colleagues here in Orange County about one patient in particular who I'm trying to get, and the child has obvious overgrowth syndrome. I mean, whether or not she's PIK3 positive or not, she needs to be on the medication.
She has overgrowth.
She has overgrowth. I mean,
and is it now that they won't allow the medication without the mutation?
well, when I met with the Novartis people last year, they told me that now the guidelines have changed, that if you do have a clinically obvious case of overgrowth syndrome, that they will allow the patient to be treated with the rejoins.
So we have quite a few people on, almost 30 are on right now, and Dr. Nelson is more than happy to take your questions. Samantha, Ava, Regina is watching, Jane from Ohio, Christine is on, Melody from Massachusetts, Tashia is watching, 𝗗𝗃𝗃, Robin Duarte, Tina. So we see you all on here, Lindsay. Tiffany says, hi from New Zealand. Let me get back, this is a long one. My 23-month-old son has been having laser on his port wine with a private specialist who uses an aggressive treatment approach and increases the laser every second treatment. His last laser parameters were 8.5 joules, 12 ml, 1.5 millisecond. We have seen good clearance after each treatment. His birthmark is on the left side of his face, nose, upper lip, and cheek. He turns 2 on the 6th of February. Due to the Christmas break, cannot do his 8th treatment until the 22nd of February, so my son will be 2 years old and 3 weeks. Would you perform laser at this age with the child awake, or just topical numbing cream, or recommending moves to treatment under GA? We have done one treatment at the hospital to see what it was like, and they have said they only treat for cosmetic purposes and are reluctant to keep treating my child, as they say he's had sufficient clearance by their standards. The hospital uses a very conservative laser with settings being 7 joules, 14 mil, 1.5 millisecond. We feel that there's been very little success with the more conservative setting, and even feel that more of his birthmark has actually come back. I'm not surprised. Following the lighter treatments, can this occur after going from using high settings to lower? Would you recommend we stop treatment, continue with the hospital at lower setting under GA, or do one last high setting treatment with topical numbing since my son has only just turned 2? As we have not reached maintenance phase, I'm unsure of what approach to take.
Well, both of the laser treatment parameters that were described in that email, these emails are how they've been coming to you. I mean, they're not, I mean, certainly the 7.5 is not aggressive. 8.5 might be getting close to the epidermal damage threshold, depending on what the patient's skin type is. But in a 2-year-old, I talk to the family, and you have a discussion. You know, if they're talking about general anesthesia, you need to talk to them about the FDA advisory that came out several years ago about the repeat treatments in infants and young children under the age of 3. So I do have 2 patients that I've treated within the last couple of weeks, where I had an extensive discussion with the family, but they were both extensive lesions, and the family said, we want the general anesthesia. But if this is combined just to the face, my preference would be to do this at an office-based setting with or without the topical anesthetic cream.
Good answer. So we have a lot of other people on. We have Rob from the Philippines. Something Anastasia is watching. I can say the first name. Hi, everybody. Jenna 𝗧𝗶𝗺𝗃. Hi, Dr. Linda, calling in from RI, Rhode Island. Hi, Scott. Scott said hi, Dr. Nelson and Dr. Linda. So again, we're here now. Now, a lot of people are getting the buzz about new lasers, and we know there's some in development, some therapies. We're hearing about photodynamic therapy. Have you seen photodynamic therapy or tried it? Or
Well, that actually, the person who first described photodynamic therapy was a physician by the name of 𝗬𝗁𝗁, who did a sabbatical at the Beckman Laser Institute in 1988.
Wow.
And he and I spent a lot of time in our animal OR injecting chickens. The rooster comb was the model for
with
port
the
wine
red.
steaks. Yes, and we did that extensively in animals, and then we started using the red light in a limited trial in patients. The problem with using the red light is that because it's a longer wavelength, it penetrates deeper into the skin. And the problem also with these photosensitizers is that they go to not only the veins, which is the target that you want, they also go to the arteries. So you have to be concerned about infarction. And we did see some patients who got a lot of scabbing and blistering after the laser treatment. Now, more recently, there's been a company in China, and I can't remember off the top of my head, it's FDJZ or something like that is the name of the company. They started a trial using green light, not a laser, a light-emitting an array of a light-emitting diodes, which means a bunch of green light bulbs. And they've been using a form of the hematoporphyrin derivative. I did visit China in January of 2019, and I actually did see some treatments. I was only there for a day after the treatments, but these patients got a tremendous amount of swelling, a lot of swelling. I mean, swelling that means you have to stay in the hospital and get, steroids to get that swelling down.
Okay.
So my only other perspective on that is I actually had a family. The baby was born here in Southern California. And I treated the patient almost to clearance. The family went back, I believe, to Shanghai, if I remember correctly. And a couple of months after that, the mother emailed me with a photo where the child had had the photodynamic therapy and had a big scab over the whole area. So the family actually is back now in Southern California, and we've resumed the pulse dye laser treatment of the child's port wine stain. So, I mean, it's an interesting idea. It makes sense putting an artificial molecule into the system, which is activated by a specific, color of light. But the issue is, how do you control, the potential damage of compromising the arterial supply to the skin? And that, I think,
and with all skins being different thicknesses based on ethnicity and skin type, and you're only looking at a population, the one population there where the study was done is in Asia, which has their own skin type, right? So
and green light will be absorbed by epidermal melanin, so that's also a problem. But I think the company contacted me last year, and I think they're interested in starting a study where they're going to do test sites. We encourage them to do test sites in non-obvious areas. So they're looking at a protocol to try and get it approved here in the United States, where we do test sites on the back of the neck, the upper back, not on the face at this point. Okay. So it's something that's out there. We're all keeping an eye on it. It's very interesting, but it's very, very early in the process.
Well, that's good to know. So let's move on to our gold standard, which is pulse dye. What's coming out new with pulse dye?
Well, Candela Laser Corporation is working on a newer iteration of the pulse dye laser. They had the Perfecto, which is probably, in my opinion, the best laser was ever built. I mean,
agreed.
Absolutely.
Gold standard.
Well, gold standard. The device never broke down. It was reliable. It delivered exactly what you needed to deliver. Unfortunately, Candela made a mistake in that they brought out the second product called the Prima, which had a lot of technical issues. I mean, they tried to combine two different wavelengths using two different technologies, namely you're using a solid state laser system, and the ND-YAG laser, and in the same box you've got a pulsed light system where you've got a giant flash lamp exciting that yellow dye to produce the yellow light. And I think trying to put two totally different technologies from an engineering perspective, namely a solid state laser and a flash lamp pulse dye laser in the same box and have them come out the same fiber was a bridge too far.
Yeah, I think they might have had that concept of the electric and gas car combined being able to work.
The hybrid.
The hybrid.
Well,
the hybrid.
It was a bridge too far. And they've had a lot of technical issues. You know, a lot of those issues have been solved, but
Right.
their plan is to come out with a newer iteration of the pulse dye laser. To the best of my knowledge, I don't think they're going to have that ND YAG laser system in the same box. I think it's just going to be a flash lamp pulse dye laser system, which will be just one technology,
With a
not
bigger,
two.
I'm assuming, because I'm hearing too, like a bigger spot size.
Well, we always want that.
Yeah, yeah.
We always want that.
Right.
You want to use the largest spot size you can.
Right, because that's fewer pulses.
Well, it's fewer pulses, but more importantly, the larger the spot size, you get less scattering with that. And what
Right.
that means is that you have a higher energy density at a given depth in the skin. So if you're treating with 7.5 joules on a 10 millimeter spot or a 12 millimeter spot, the light density and energy below the surface is going to be higher with that 12 millimeter spot than a 10. It'll be even higher in a 14, or 15. So, I mean, the technology continues to get better. So we'll see. There's been rumors that it's going to come out sometime this year, since we're now in January of 2024. But I think the company is bringing out the technology very conservatively. They want to make sure all the T's are crossed and the I's are dotted before they do this.
Well, ever hopeful. So Lacey has a question. My son is 7 months old and has had 10 treatments. I feel like the last 3 treatments haven't done much. Should we stop? Reevaluate with our doctor. We are registered for the Miami Free Clinic. We have that coming up next month. And I cannot wait to have a second opinion.
Well, the first thing we need, when you go to Miami, this is with 𝗂𝘗𝗃, I'm going to say.
Right.
You need to get copies of all of those previous medical records. I mean, you want to see what treatment parameters are being used. I mean, a common mistake that I see when we have patients who are referred to our institution who have been elsewhere and haven't got achieved the clearance that the family was expecting is that they did every single laser treatment using the same pulse duration of the laser. And what we know, if you take a biopsy of these kids, you'll see blood vessels of different sizes underneath the skin. So what that means from an engineering and optical perspective is that you need to use different pulse durations of the laser. So the treatments that we do at our institution, we're constantly changing that pulse duration of the laser exposure. And I'll tell the family, today I'm going to use a shorter pulse duration of the laser. Therefore, you can expect a lot more bruising after the laser treatment's done today. Or I'll say to them, this time I'm going to use a longer pulse duration of the laser. They're not going to have as much bruising.
Right.
So you have to use different pulse durations of the laser. And so when you're doing that, as I said, you're not necessarily going to get as much bruising with the longer pulse durations. And sometimes parents confuse, well, my son didn't get bruising. That means the laser treatment didn't work. No, the first question needs to be asked is, what pulse duration of the laser was used?
That is an excellent answer. 𝗃𝗃𝗃𝗃 Anastasia wants to know, thank you for this live. I have an almost 8-year-old son who has a large port wine on the outer side of his right leg from the buttock to toes. We haven't done much. Is there anything I should be doing, like routine tests and monitoring by a specialist? So he's 8 years old.
Well, if he's 8 years old, he's got an extensive, posterior buttock and lower extremity port wine stain. The first thing I would do is that I would order imaging studies on that lower extremity. I would order an MRA of the pelvis and the entire extremity to rule out underlying 𝗃𝗃𝗃 syndrome. I mean, that's the first thing that comes into my mind. So my first option would not be to start laser treatment. What I would do would be to order the imaging studies. If the imaging studies are negative, okay, we could begin doing laser treatment. But if the imaging studies do show underlying 𝗃𝗃𝗃 syndrome, I will refer the patient and the family to an interventional radiologist here in Orange County, Dr. Kari Nelson, whom many of your viewers may have met at the different conferences. Kari is excellent. She's not my wife. She's not my sister. She just has the same last name. But what they can do, the interventional radiologist, is that they can get rid of many of those abnormal veins that are associated with the 𝗃𝗃𝗃 syndrome. And in particular, you want to stop the shunting of the blood from the deeper venous system to the surface. So if they close off those collaterals and those connecting veins, the laser treatment will actually be much better.
Well, that's what I wanted you to say, is by getting the treatment with the interventional radiologist does not preclude them from laser.
No, just laser later.
Right.
You have to do things in the right order.
In the right sequence.
It's just like patients who come to see me, cosmetic patients, they'll come in and say, I want you to treat my leg vein. Well, the problem with the leg vein isn't that little spider vein that they see on their inner thigh. The problem is incompetence in the greater saphenous vein due to probably multiple pregnancies or just with the tincture of time. We all get this. So I refer them to my interventional radiology colleagues for, image-guided scleral therapy, and I don't do laser treatments of those patients because they'll recur.
Okay. Well, we have a lot of questions, but also just remember, because your son is 8, he's probably getting into puberty, and that's when these start really acting up with puberty and also different growth spurts.
And your pediatrician should be measuring, the thigh and the calf area and comparing it to the other side. That should be done and documented at every office visit with your pediatrician.
Every annual visit. So Liv from New Zealand says her 9-month-old baby has a port wine on her cheek and neck. She's had 10 treatments from which we have seen great results, but we've been battling an eczema flare. We see that a lot. We have tried various steroid creams and moisturizers. Do you have any suggestions? I'm wondering if it could be food allergy related. She also gets eczema on other parts of her body, but it's mild in comparison to her port wine.
Well, we know there was one study that showed about 20% of kids who've got port wine stains will have eczema in association with their port wine stains. And so basically
20%?
Yeah, it's quite high. We have a lot of patients at Beckman who have.
Do we know if it's a consequence of the laser?
It's not a consequence. No, they have the eczema. They just
Okay.
they just develop the eczema on part of their port wine stain. And so, some of the things you mentioned, you want to get rid of all detergents and soaps, cool compresses, conservative moisturizers like 𝗧𝗶𝗺𝗃, which is very, very popular, very hypoallergenic. And then you can start with a topical steroid. I'll start with 1% hydrocortisone, which the patient can actually buy over the counter.
Right, the 𝗧𝗶𝗃 is excellent.
And then slowly increase, the steroid potency. And so gradually, sometimes we have to really treat these kids like they've got serious atopic dermatitis and put them on medications like tacrolimus and things like that, which are used to treat very serious skin disorders. But most kids, if you calm down their eczema, you'll notice that port wine stain is going to be a lot lighter.
Yeah, I actually get this a lot, so I kind of sometimes have told them to hold off continuing laser until the eczema clears up.
Well, some of my colleagues would argue it's a good time to treat with the laser because the skin is red.
I know.
The blood vessels are dilated. You've got more chromophore to absorb the light.
Good point.
So when families come in to see me, they say, well, are you going to treat the area that has the eczema? I say, absolutely.
Okay.
And do treat
Good
it.
point. Tamima says her daughter is 3 years old, has 𝗔𝗶𝗃. She has wine stains, a flat angioma on her right side. For my part, I have a few questions. At what age is it best to start laser? On our part, we haven't started yet, and she's 3. How does the laser treatment work? Will she be anesthetized? Is it painful? How many sessions will the treatment be, and how much will it cost per session?
And where is this coming from?
She just says Tamima. She doesn't say where she's from.
Okay. Well, first of all, we want to start the laser treatment as soon as possible. I mean, we know infants and young children respond better as compared to young children and adults. And you can think about it, there's a number of optical reasons for that. Number one, the skin of children is much thinner, so the light has less depth to penetrate. The blood vessels are smaller in infants and young children, so they're an easier target for the laser to destroy. Infants and young children have much less collagen in their skin, so more light will penetrate into the skin as opposed to being scattered, that we talked about a little earlier. And then also, you can actually get these large blood vessels above the smaller ones as patients get older. Sometimes, we think, well, these blood vessels are just right underneath, they're deep in the skin. Many of the biopsies that we did years ago, right at the subepidermal junction, you can see very, very large blood vessels. So we try and treat kids as young as possible, and by that I mean days, weeks old. I mean, later I think on tomorrow, Wednesday, I've got a couple of kids who were 3-4 months old that are now on their 4th or 5th laser treatment. all done.
What a paradigm shift too from years ago, right?
All being treated on an outpatient basis without anesthesia.
Beautiful thing.
You asked how the laser treatment works. You can think about it that at 5 o'clock on a nice day, a black car gets hot because infrared light from the sun is well absorbed by the black pigment in the paint. A white car or a yellow car or a silver car doesn't get hot because there's no absorption of the light. So how the laser works is the yellow light is highly absorbed by things that are red, namely the abnormal blood vessels underneath the skin. So the light from the laser will go into the skin and it will be selectively absorbed by those blood vessels underneath the skin.
And to answer some of your other questions, no one can answer how painful it may be. No two kids are alike in the way they respond.
No.
So you could get a test spot done. This is what I recommend, is just get a small test spot done, see how your child responds. At 3, and even though you say, and we do start treating 1 week old, 1 day old, but still at 3, you can get good clearance if she gets into a good program and has routine, like once a month at least. You want to continue to see the clearance. And again, no one can say how many treatments it will be, which she wanted to know, because you have to see how that person responds. Yeah. And even then, it's...
Is it a high flow lesion? Is it a low flow lesion? Right. Is the lesion darker, more deeper in the skin? That can be more of a challenge.
So Lacey says, thank you, Dr. Nelson. I will be sure to get the records for Miami. Very good. Tiffany said, can you please explain more how changing up between shorter and longer pulse durations of the laser works? Our doctor has only ever used 1.5 milliseconds and only changes the joules. Should we be suggesting he changes it up?
That's a conversation you're going to have with your physician. I mean, you're talking about the joules, you're talking about the energy density. What I was talking about was the pulse duration of the laser exposure. That means how long is the laser actually on? If I was sitting there turning the light off and on in this room, we would say that the light is on for 1.5 milliseconds. But what we know is that smaller blood vessels will respond better to short pulse durations of the laser. And the reason for that is that if you use a longer pulse duration to target a very small blood vessel, because the laser exposure is long, the heat, although it initially starts to form inside that blood vessel, during the laser exposure, it's actually starting to come out. So for small blood vessels, you need short pulse durations of the laser to rapidly heat up that small vessel. For larger blood vessels, you need longer pulse durations of the laser exposure. So in adults, it's not uncommon at all for me to use 3 milliseconds. Or some of the patients who've got the really darker purple port wine stains, I've actually been using 6 milliseconds and gotten very good clearance of those really dark, resistant purple areas.
That's a great answer. And this one's interesting. Alida says she has a port wine all over her torso and that it's red and dark blue. And she said, I know there isn't any laser for those, probably meaning the dark blue. But my question is, does anyone else have digestive problems? And, when the torso is involved with vascular, especially if it's a KT or Parkes-Weber, often they can have digestive problems because the stain is usually what's going on out here, but then there can often be stuff going on.
Yes, that's very well, that's true.
So it's not uncommon. You would need proper imaging done, an MRI with contrast, MRA, to get a good look at what's going on in your digestive system to see if there's some
colonoscopy or an upper gastrointestinal endoscopy.
True.
That would actually be the better one.
You're right.
I mean, there's a disease called hemorrhagic hereditary telangiectasia, Osler-Weber-Rondeau syndrome, where people have these spider angiomas on their skin, but they also have them throughout their gastrointestinal tract.
So, and nosebleeds.
Yeah, that's the first question. When I see a patient like that, the first question is, do you or anybody in your family have a history of gastrointestinal bleeding? Because that's been very well described in the literature.
Thank you. Rachel wants to know, how often should we be aiming to treat a port wine? My son has a facial port wine and just turned 3. We are from Eastern Canada and the closest hospital is 10 hours away. We have only had 3 treatments and are going for our 4th next month. It's frustrating because they only do a laser clinic monthly, so we can only get in once or twice a year. Even with the gaps between treatments, is this still beneficial? It's so frustrating.
Well, what I would tell you would be to look up Eastern Ontario School of Medicine. My former fellow who just finished last summer, her name is Dr. 𝗗𝗄𝗧𝗏. She is an ENT facial plastic surgeon. She spent an entire year with me and did a lot of laser cases. I mean, she probably did a couple of hundred of laser cases. So I can refer you to
𝗗𝗄𝗧
for an evaluation in Ottawa. Well, that's where I believe that Eastern Ontario School of Medicine is. But we're treating the infants as young as possible. We're treating those kids sometimes even every week or 2 weeks. I mean, I will just ask the parent, how aggressive are you willing to allow us to be? Now, there are some downsides to that. Sometimes when you're doing it so aggressively, you just get irritation of the skin. In fact, one patient who's coming to see me tomorrow, I was treating this baby every week, and then there was a problem with her insurance. Her insurance would not let her come back to the Beckman Laser Institute. It ran out, it changed, I don't remember what it was. So the family switched insurance to Blue Shield of California, which is accepted by the University of California. And so I hadn't seen them in like 6 weeks, and I was amazed at the amount of clearance.
Wow.
Amazed.
That's amazing.
Just because, sometimes when you're doing them so aggressive, the skin does get inflamed.
Right.
I mean, we talk about that selective absorption by blood vessels, but the layer above it does have melanin, and that also absorbs the laser light. So it's not, when we say that, we're specifically targeted by the blood vessels, yes, the light goes into the skin, but there is going to be some inflammation in the normal skin.
Natalie said, thank you for this session. I have a 2-year-old with a facial port wine, V2, I believe, cheek and upper lip.
That's V2.
We are currently in observation maintenance. We've had decent clearance, about 50%. He received 18 treatments. What is your opinion on the effect of sun exposure to lesion progression? Of course, we are diligent with sunscreen, but live in Florida, so this is an area of concern.
Well, I'm not aware of any sun exposure causing port wine stains to get worse. So I wouldn't be worried about sun exposure from that point of view. If this was a hemangioma, Martin Mem, you told me, you referenced a little bit earlier, once told me that all infants and young children with hemangioma should stay out of the sun because he believed that because of the rapidly proliferative nature of those lesions, that ultraviolet light exposure actually could make them worse. But the point be, if you are living in Florida and you're having laser treatment, you need to observe strict sun precautions. And by that, I mean your child needs to wear hats and sunscreens every day. Because if your child does become tanned, we were just talking about epidermal melanin. If you have a higher concentration of epidermal melanin in the skin, that is going to block the laser light from going down deeper into the skin. It's going to make the laser treatment less effective. So the sunscreen that I recommend is 𝗚𝗏𝗏 UV Clear. It's what all my dermatology colleagues use. It's what both my wife and I use. We're both very allergic to sunscreens. They're full of chemicals. So you can buy it on Amazon. 𝗚𝗏𝗏 UV Clear.
How do you spell it?
ELTA, ELTAMD UV Clear.
Okay, thank you for that. Jenna says our derm recently suggested intranasal spray for our son, who is 2, to help with stress during laser versus just topical. We were open to it and excited that it would make it easier. This doesn't seem to be the case. It was still incredibly hard. What is the recommendation for general anesthesia for a 2, almost 3-year-old? His port wine goes from his bum to toes on both sides. Would once or twice a year be okay? His pediatrician has ruled out KTS, but he has never had an MRI. I heard you respond to it in a former question. Should an MRI be done at a certain age?
Well, I would order the MRA. Now, I wouldn't do that until the child, it's not really going to make much difference in an infant or a child who's not doing a lot of weight-bearing activity.
Well, he's 3, so he is walking.
But I mean, in adults, I think, I have one kid who comes to see me. She's a very good tennis player, but she's got KT. And I'm trying to get her off the tennis court and onto the swim team. So, I mean, I would order the imaging studies just to rule out. I mean, an extensive port wine light stain from the buttock down both legs, that there's a significant probability that is KT syndrome. As to your other question, he's almost 3. Again, I would have a discussion with the family about how comfortable they feel, having their child put under anesthesia with that FDA advisory in place. Now, one thing I can tell you is that I have one child here in Southern California. Both her parents were pediatric neurologists at Loma Linda University Medical School. And I showed both of them the FDA advisory, and both of them said, we have no problem with you putting our child under anesthesia.
Okay.
So,
there you go.
I've been treating kids for 35 years. I am not aware of any significant developmental abnormality in the infants and young children that I've been treating.
Right, and
we've got kids at Stanford, at Harvard,
I know,
at Yale.
and by the way,
UC.
which is what I brought up at the Laser Society meeting, there's no other area of medicine where a child would be subject to a monthly treatment that's elective, other than port wine. Where else would a child have to go under anesthesia every month?
Well, you've also got to remember these are also basically healthy kids.
Yes.
Yes, the kids with SDP syndrome do have a whole constellation of problems that need to be addressed. And the exposures are very short. A hemifacial port wine stain can be done in less than 5 minutes of general anesthesia.
Right, exactly. All right, well, we do have a lot of questions coming in, and we're down to 25 minutes left. Regina said, what are your thoughts on the 𝗓𝗲𝗃 for a 5-year-old child on the cheek and neck after doing 10 pulsi and not getting great clearance? How does the 𝗓𝗲𝗃 compare to the Perfecta?
Well, I have heard from my colleagues that the 𝗓𝗃 is a solid state laser. We talked about solid state lasers before. It's an ND YAG laser with a KTP crystal in front of the ND beam, so you get green light at 532 nanometers. So the first things right off the top are, number one, that's going to be higher absorbed by epidermal melanin, which can be a concern in patients with darker skin types. Also, the green light is not going to penetrate as deeper into the skin as yellow light. Longer wavelengths go deeper into human skin. So it's not going to penetrate as deeper, and you do have the issues with epidermal melanin. The 𝗓𝗃𝗃 has been out now for quite some time.
𝗓𝗃𝗃 or
𝗓𝗃𝗃. The 𝗓𝗃𝗃. I'm sorry, there was a 𝗓𝗃𝗃 a long time ago. But the 𝗓𝗃𝗃 has been out there for a while. But I am not aware of any large retrospective study that has showed that the 𝗓𝗃𝗃 was superior in terms of port wine stain clearance as compared to the pulse dye laser.
No, but we can just also say, go get a test spot.
Go get a test spot and see.
That's it. Samantha says, hi, Dr. Linda and Dr. Nelson. My son is 18 months old and has 𝗔𝗍𝗃. We started laser at 10 days old. Bravo, mama. And he has had 21 treatments. Every treatment still makes the port wine stain lighter, but his doctor still doesn't think we've hit maximum clearance. He does do some treatments at both 1.5 and 3 ms. We typically go monthly. Now, would you recommend we just keep at it? Have you had any patients that have needed this many treatments?
No, absolutely. Absolutely, I have. I have 3-year-olds who we've been treating. The parents continue to see the clearance, and we continue to do the treatment. You can certainly take a stop for maintenance, but when the child goes through a growth spurt, you'll notice that port wine stain is slowly and insidiously going to come back. So I would definitely continue the treatments, particularly if I understood the text correctly, that you're continuing to see improvement. If you had told me in that text, well, we've done all these treatments, but the last 3 we've seen really no improvement, then I would say it would be a good idea to maybe take a break for 3 to 6 months.
Excellent. Teeny Marie. Hi, Teeny. She's in her early 40s and has been treated off and on for over 35 years. 35 years ago, a doctor burned me with a CO2 laser. Well,
the CO2 laser is going to be absorbed by water in the outer layers of the skin. The CO2 laser is actually used for laser resurfacing. It's going to burn the surface of the skin.
Right.
So nobody is going to be using a carbon dioxide laser anymore to treat port wine stains.
So she's been treated by Dr. Friedman in Houston, but was told you'd be the expert with the burned skin. I've had no progress despite multiple treatments over the last few years. I recently lost vision in my eye. They don't think it's compartment syndrome. I'm having an MRI, MRA, and ultrasound tomorrow to rule out 𝗗𝘗𝗃𝗃𝗃. Could treatment help reduce future complications? I'm currently doing 1 to 2 maintenance treatments with 0 improvement. Do you think any type of color reduction is realistic? The color is. I'd love to see the best of the best to see if there's anything. She's in Texas, and I've seen her. I mean, she could come here.
Well, first of all, she was talking about her port Weinstein, and then she was talking about scars.
She got severely burned when she was young with a CO2 laser.
Okay.
So she's been going to Friedman to try to clear it up, but hasn't.
The scarring or the port
scarring,
Weinstein?
the scarring.
Okay. Well, certainly the scarring can be treated using fractional laser skin resurfacing. And there are 2 types of fractional laser skin resurfacing. We do a lot of this with burn scars because we have a burn center here at UCI. So we treat a lot of burn scars, traumatic scars, post-surgical scars, just other scars that can arise, using these combined techniques of fractional skin resurfacing. And what these lasers do is they heat up the collagen underneath the skin. And when you do that, you stimulate the formation of new collagen. It does take multiple treatments, but in my experience, the scars, particularly if they're on the face and neck, will respond very, very well to fractional skin resurfacing. Fractional skin resurfacing does not work nearly as well on the trunk or extremities as it does on the face. But I would definitely continue the treatment with the fractional skin resurfacing if that's what's being done. And if it's not being done, I would seek to have that fractional skin resurfacing.
And she can come and get a consult with you.
Yeah, I'd be happy to see her. Sure.
This is your area. So
Or in the conference in New York, we're all going to New York. When is that? I need to get that on my
October 4th and 5th. So October 4th. And by the way, this is our first Facebook Live for our 30th year anniversary, 30 years this year. So October 4th is the gala in New York City, and the 5th. And on the 5th will be the clinic and laser and all of that. So it's the
And she
4th
mentioned all these ocular problems. You know, she had been worked up for glaucoma. I mean, she's losing the vision. Number one thing that comes to my mind is that she's got glaucoma, bad glaucoma.
Well, I think I had talked to her about that when we were on another group thing, but she can email me and we can talk about that too. I mean, to get that checked by a glaucoma expert.
Well, that's an easy thing to do, especially in Houston at the Texas Medical Center. That could easily be done.
So a lot of your patients are saying, hi, we'll see you, like 𝗓𝗓𝗃𝗃.
Yeah, just saw her last week.
Yeah, and she said she'll see you soon. So there's a lot of them here who are, they're all watching and seeing you. She's 40 years old. She's been okay, yeah. So this was the same one, the one that was teeny just now. 𝗓𝘁𝗃, curious your thoughts on conscious sedation for laser. For background, I work in a level 1 trauma ED, and we often place pediatric patients under conscious sedation with medications like ketamine to reduce fractures. I understand those are totally different circumstances, but I've wondered if that's a possibility. My niece has started treatment with VBF perfecta, but we're not to the point of needing anesthesia. Is there any data or research that supports this type of sedation?
Well, we do not do conscious sedation at UCI for infants and young children. I mean, we're always concerned about, the doses of these drugs. And the other thing is, ketamine and many of these other medications, they're very long acting. So if you give, a lot of kids the parents will want us to give them some Xanax, or some kind of anti-anxiety, medication in association with their anesthesia. And I can do the laser treatment in 5 minutes, but then the child is in the recovery room for 2 or 3 hours because it takes that amount of time for these agents to wear off. Now, we do what we call monitored anesthesia care in some adults. Now, what that means is that they're given a very low dose of intravenous fentanyl and some kind of short-acting, anxiety agent. And for many of the patients, we don't have to put them to sleep. They'll tolerate that very, very well. We do a lot of teenagers that way and have found that to be very, very helpful.
Okay, so I'm sorry, there were some questions that got broken up, so you can resubmit the ones that didn't go all the way through. And I want to just, while we get that next question in, because we're down to 17 minutes. So at what point, I'm very happy that you do the talk. So you have the talk with the parents when they start indicating to you the child's getting anxious when they approach the building, or they know. So that's when you have the talk and say, look, we don't know, because we don't know. Is this going to traumatize the kid for life, or is the kid going to be okay? So do you switch to the anesthesia, or do you just do the talk and say, well, it's not recommended to have like monthly general anesthesias under age 3, but it's up to you.
No, it's up to the parent.
Yeah, that's what I mean. It's up to you, meaning the parent.
I have that discussion with them, and fortunately, at the ภิ𝗏𝗄𝗏 Institute, we have an operating room right in the institute. So to me, it's not where a lot of physicians don't like to do anesthesia because they have to go to another facility to do it. Whereas at Beckman, we have it right there. So it's just a matter of, instead of you coming in on Tuesday, you have to come Wednesday or Friday when our pediatric anesthesiologists are available. But I always let the parent make, I will tell them about the advisory. I actually will tell them about, the Loma Linda pediatric neurology parents. I will tell them that, in the best of my knowledge, I am not aware of any children that I have treated that have had some type of cognitive, abnormal development in later years. But I will always defer to the parent, and I will do what they want. And as I said, I do have 2 children right now that are under the age of 2. The parents want them treated under anesthesia.
Right.
That's what we want, and that's what we will do.
That's it. Question. Hypopigmenting and hyperpigmenting. I see a lot of patients that have laser, and if they have any kind of brown in their skin, they might develop some hypopigmentation.
Well, both can happen.
Right. Well, that's right. So I was just going to deal with the first one is when it's hypopigmented, so you get white patches, regardless of the skin type, everybody has some melanin, and you can have hypo. Do you tell them to not have the next treatment, or do you treat with the hypopigmentation?
Well, that was a discussion at the ASLMS, last year. I mean, the hypopigmentation results because the epidermal melanin, this typically occurs in patients with darker skin types. Somebody like you is not going to get hypopigmentation after a laser treatment because you have a very light skin type. This is something that can happen in Asian patients, Afro-American patients. I've seen it in Indian patients a couple of times, dark Indian skin patients. So what happens is the epidermal melanin absorbs too much light, and it sloughs. Now that will come back typically in about 4 to 6 weeks. So as long as you've told the parent this could happen, and if it does, it'll be fine in 4 to 6 weeks. But the question you're asking is an interesting one because in that period of time where the skin is totally white, there's no melanin there to compete for the laser light.
That's true.
So you actually, from an optical point of view, you've changed that patient with a darker skin type to somebody like your skin type. So one would argue that actually is a very good time to do a treatment before that epidermis starts to...
Have you tried that? Have you done it?
We have a couple of times, and we've told patients, I've explained all of that to them. It's a little bit of an overwhelming discussion where a parent perceives that hypopigmentation to be a problem, but me telling them it's a good thing, and we might be able to take advantage of that. So, but it is an interesting discussion. The hyperpigmentation, again, the same thing, epidermal absorption by the laser light, particularly in darker skin type patients. You activate those melanocytes, they start producing pigment. Again, that will usually calm down with the tincture of time. But by tincture of time, I mean 3 to 6 months sometimes. There are things that you can do. You can buy this, I can't remember the name of the company.
Like a hydroquinone?
Well, you don't want to use hydroquinone in infants and young children.
No.
But there's a product from 𝗧𝗶𝗺𝗏𝗂𝐴𝑠𝑦𝑒𝑠. It's called Skin Protection System. People can Google it. It's a mixture of kojic acid and tranexamic acid. Now, tranexamic acid has been used to treat women and men with melasma. It basically shuts down melanosome synthesis. So for patients who get that, if they're concerned or it's not going away, you can have them use something like that.
With the brown hyperpigmented spots.
In infants and young children, the SkinCeuticals I'll use. In adults, if they want, we can certainly prescribe hydroquinone.
So Gina, who works for VBF, our very own Gina Roth, so she has lymphangioma circumscriptum, which everybody always confused for a port wine because it's pretty flat.
Yeah.
But it is. And she said, thank you for the recommendation for the sunscreen because she's very sensitive.
Yeah.
So would somebody who has a 𝗧𝗏𝗄𝗃 circumscriptum versus a port wine need a different sunscreen, or would it just be the same?
No, usually it's just the same. I mean,
Just
it's
the
just
same.
the same. I
Just
mean,
curious.
I just would be curious. Is she on the
No, she was.
phosphodiesterase inhibitors, the Cialis, or the generic Viagra?
Nope, she's not on anything.
Is her lymphangioma circumcision, is it improved with just the laser?
She hasn't had anything, no laser, nothing. She's just leaving it.
Because is she having oozing from the?
She gets a little bit of like oozing every couple years, and then goes to see her dermatologist. And takes care of it.
Kari Nelson, who I mentioned 10,
Right.
15 minutes earlier,
Right.
she and I published a paper together showing the treatment of lymphatic malformations, including
Lymphangioma
circumscriptum, that these inhibitors, like Cialis and the generic Viagra, are wonderful drugs for treating that. And so when I see a patient like that, the first thing I do is we start them on those medications. And that will really dramatically reduce the oozing. Sometimes the laser is always not the best place to start.
That's true. That's true. 𝗧𝗶𝗺𝗃, yes, you can ask a question. She wanted to ask you a PIK3CA question. So feel free, while we're talking, to submit that question. PIK3CA, even though now everything associated with that is overgrowth, right? Any tissue overgrowth, it presumes the presence of PIK3CA. A lot of people ask me with a port wine stain, is that going to be PIK3CA? Well, some port wines do end up with overgrowth, and they get more overgrowth as time goes on. And we don't know if those are PIK3CA.
But the overgrowth is not due to the port wine stain.
I know.
There's something
There's a factor.
There's
It's
something
some factor.
else going on.
And that's what Dr. Mim and I were talking about before he passed away, was about this overgrowth factor, or this PIK3CA mutation being in some port wines and not in others, and is that why some get the overgrowth lip?
Yeah.
And we don't know now.
Well, Wen-Bin Tan, who you know very, very well, Wen-Bin and I published a study that showed there were some certain pathways, MAC kinase pathways, that do become overactive in patients who have hypertrophic port wine stains, as well as patients who've got nodular port wine stains. So definitely they have nothing to do with the PIK3 gene mutation, but in some patients who've got these hypertrophic lesions, you actually do have disruption of these MAP kinase pathways.
Very interesting. So 𝗧𝗏𝗃 says her 20-month-old has a vascular birthmark on the right side of her face, more marbled than flat. She also has slight overgrowth on the entire left side of her body, no visible vascular malformation on the skin. Did a biopsy 2 weeks ago for PIK3CA and hoping that comes back with a result. She's been showing some developmental delays consistent with autism, maybe, but I'm wondering if it may be related to her syndrome. We did a brain MRI right at 1 year old and everything came back normal. I'm wondering if you think I should get a second opinion on MRI or get another one done, or maybe have Dr. Comey look at it?
I could have Ann Comey, but we're going to assume that the radiology read this correctly. So 𝗧𝗏𝗺𝗃 syndrome is ruled out. But the question is, with all of this overgrowth that she was talking about, does her child have some overgrowth syndrome?
Right.
And we'll have to see what the result of the first PIK3, biopsy when it goes to St. Louis and then comes back, what the result is. But as I said, maybe 20, 30 minutes ago, we were talking about overgrowth syndromes, that now there is this Novartis drug, which, a lot of people...
𝗏𝗏𝗃?
Yeah.
Is this the 𝗏𝗏𝗃?
Well, the 𝗏𝗏𝗃, I can't remember, but you're right, it's 𝗏𝗏𝗃. But the consensus now in the pediatric dermatology community is, even though the PIK3 biopsy test is negative, if the patient has obvious overgrowth, they should be started on these inhibitors immediately. And they can dose them to young children. It's actually, the dose that you use for a child is not really that much different than the dose that you use for an adult. Now, I don't generally prescribe those at the Beckman Laser Institute because these are drugs that disrupt a lot of different pathways. The patients need to be followed closely. So generally the patients who come through our practice, we refer them to the Children's Hospital of Orange County, the Department of Hematology Oncology, and they follow those kids.
Thank you. Katie wants to know, thanks in advance, a recent MRA showed increased adipose tissue in spinal bone marrow, same area as port wine. Blood work was normal and waiting for next steps. Have you seen this before? Well, we see that with KTS.
Yeah, you do.
The
You
fat over,
You do,
overgrowth.
definitely you see the fat over, but it's interesting that it's actually inside the spine. Did I read that or understand
Well,
that
she
correctly?
says that showed increased adipose tissue in spinal bone marrow. That's interesting.
That
I
I'm
don't
not a
know. I'm not
hematologist.
sure.
That I cannot
Yeah,
answer
have
that.
to see that. You can feel free to. They'll post in here Dr. Nelson's email and mine for further follow up with any of you on any of these testing questions. Tiffany said, when treating children aged 2 years who have port wine on their face without GA, what suggestions do you have for their treatment approach given they're older? Is there anything you do differently, I guess, than an infant, like with a 2-year-old? Like, do you do any 𝗧𝗶𝗺𝗀, like this sugar drop?
Yeah, we do that. I mean, we have a sucrose solution, the 24% sucrose solution. I mean, with the infants, I tell the mother, starve the child for 2 hours before you come in and bring us a bottle, and we'll give them the bottle. That often works very, very well. For the older children, we'll give them, a 𝗓𝗃𝗃, and if they'll take that and we'll soak it in the 24% sucrose solution, and that calms them down.
Right. Just enough to take the edge off.
You only need a couple of minutes here.
Yep.
And that's enough of a distraction as all that glucose goes into their bloodstream.
I put that in our guidelines meeting, the little 𝗧𝗏𝗃s
Yep.
to use them. Natalie said, I'm concerned we may have received too conservative of a recommendation to wait until my son is old enough to want the treatment again. So GA can be avoided. This would mean he would be around 6 to 8 years old before resuming treatment. Is there a benefit to continuing to treat at a young age, he's 2, with regards to avoiding future lesion progression? We were not continuing to see improvement, but also did not achieve significant clearance from 16 treatments that began when he was 4 days old. Around treatment 15 at 1 year, it was significantly reduced, but by 18 months it stabilized with a darkening appearance.
Well, again, I would look at the different laser treatment parameters that have been done and possibly, consider changing the pulse duration of the laser exposure. But, the question is during this time period, has this child, gone through a growth spurt? It's actually amazing, because when we weigh these kids, because they come in all the time, we weigh them. Some of these children, in 3 or 4 months can gain, 4 or 5 pounds.
Yeah, double their weight.
I mean, it's that which, the parent might not obvious, because they see them every day, but I see them, every couple of weeks or months, and it's obvious to me that they've gone through a growth spurt. So that could be one reason, but I would always treat the children as young as possible. I would not wait. We know this is a progressive disease. I mean, that's been well described in the literature. It's not going to get better.
It's not going to reverse under any circumstance.
Hemangiomas, yes.
But not port wine.
Not port wine.
So because we're down to our last 4 minutes, I got to get through these questions. For a port wine, should we pursue genetic testing? The MRI was clear, but he woke up mid-contrast and they had to end early. We have plans to do another MRI. Would it be beneficial to see genetics? Is there something more we might find for a port wine?
Well, there was the suggestion in some population of 𝗧𝗶𝗺𝗃 patients, the GNAC mutation.
Right.
But we actually did a study of that, and if you look at the details of that paper that was published in the New England Journal of Medicine, they considered the test to be positive if a certain percentage of cells were positive for the mutation. So, I mean, the number was very, very low. It was like 2 to 5%. So that means, 95% of the cells were normal.
Right.
But, it depends on what the threshold is you want to say that the test was positive. So in the absence of some kind of overgrowth syndrome, I would not recommend pursuing a biopsy to look for the GNAC mutation.
Okay.
I'm a little puzzled what she means the patient woke up during the middle of the MRI. I mean, that's an anesthesia issue. Why did the patient wake up in the middle of the MRI?
I don't know, but we're right down to the wire. And this is a good question. Someone's port wine stain on their child was just treated on Friday, and on Sunday he had a bloody nose. Is this from the port wine or from the laser?
Well, it's not going to be from the laser. The light from the laser is not going to go through, through a nasal ala and cause nasal bleeding. The question is, does the port wine stain itself actually involve, the nasal mucosa? And we've seen that.
Or is there an
could,
underlying
could there be an underlying AVM?
So,
I was just
email me, 𝗬𝗁𝗍, Dr. Linda, VBF president at gmail.com, so we can continue this discussion and find out where you are to maybe get some further testing, because this is what we don't want.
Well, they can come to the conference in New York, where they can see all of the specialists. You can get that free ultrasound done by Dr. 𝗗𝗃𝗏𝗃. So come to New York, November 4th, 5th. What was it, the date?
October 4th and 5th in New York. We'll be launching registration probably the first week of February. We're still ironing out some details. Aiden said his son is 4.5, has developed a blister and subsequently an hypertrophic scar on his upper lip following his last laser session 4 months ago. We were suggested a PTL plus steroids and 5-FU intralesional injection under GA. Would that be your first line? You mentioned fractional laser. Would that be non-ablative? What wavelength? Would be great to get a name for that laser so we can consult our doctor. Would love to understand if resurfacing should be done instead of PDL injection, or what combination to do in a child.
Well, if the hypertrophic scar is red, definitely use the PDL. We will do that, and then we will combine it with the fractional skin resurfacing. We typically use the 1550 nanometer wavelength. There's a whole variety of non-ablative fractional lasers. We do that. We do it at a very low dose. And then after that, I tell the parent you want compression with some kind of silicone bandage, 𝗬𝗓 scar therapy, silicone strips. You want the family to use those 24 hours a day. And by that, I mean 24 hours a day. And that should definitely calm down, that hypertrophic scar and flatten it out, in combination with the PDL and the fractional laser resurfacing. 5-FU does work for hypertrophic scars. I have not seen it used in a child, but certainly if you look into the literature, 5-fluorouracil is an excellent treatment for a hypertrophic scar if it's localized.
Thank you. What a very exciting January Facebook Live with you. It's over. It's been an hour. It's been very busy. You can all go back and replay this continuously to hear his answers. You can go back to 2017 and all the sessions that I've done, because we have them all at birthmark.org. Click on the upper right corner of the YouTube channel. Next month, I will be with Dr. 𝗬𝗁𝗃 in Florida live. So join us next month. There's also a free laser clinic there. You can go to our website at birthmark.org. And as Dr. Nelson said, we have our free super clinic in October on the 4th and the 5th in New York City. So thank you very much for your time. Happy New Year, and let's pray for a happy and healthy year for all of us as we go into our 30th anniversary year. Thank you all.
Bye-bye.
Thank you.